All right, let's jump right in. If you're in primary care, you know that managing chronic pain is, well, it's pretty much our bread and butter. The Ministry of Health has just dropped a new CPG, and we're going to pull out the absolute must-know practical stuff you can use in your clinic tomorrow. I mean, this is a familiar sight for all of us, right? The guideline actually confirms what we already feel in our gut, that pain is a huge reason people walk into our clinics. And that's exactly why having a clear game plan isn't just a nice to have, it's absolutely essential if we want to give good, consistent care. And look, the guideline doesn't waste any time. Right up front, it says this: a poor assessment is a major barrier. It's basically telling us that everything hinges on that initial workup. If we get the assessment wrong, the whole management plan is built on a pretty shaky foundation. Now, this is a really important point. This CPG isn't just some document sitting on a shelf. It's part of Malaysia's big national push, the pain-free program, and making pain the fifth vital sign. So what does that mean for you? It means this framework has real authority. It gives us solid backing for the decisions we make every day. So here's what we're going to cover real quick. We'll start with the new playbook, then walk through a patient assessment, talk about spotting those crucial red flags, look at management strategies, and wrap up with the key takeaways. All right, first up, the new pain playbook. Let's just get a feel for what this guideline is really trying to do for our practice. Okay, so the guideline starts with the basics. We're talking about pain that sticks around for more than 3 months. But here's the key thing it emphasizes, this idea of the biopsychosocial model. It's really driving home that pain isn't just about damaged tissue. It's a whole person experience. It's shaped by biology, sure, but also by what's going on in their head and in their life. That's a huge mindset shift. Okay, so theory is one thing. Let's make this practical. We're going to take a super common complaint, headache, and see how this guideline's step-by-step approach actually works in the real world. And this is it. This is the core workflow right here. The guideline lays it out so clearly. You see how it all starts with a solid history and exam? That's non-negotiable. We have to do that thorough workup before we even think about what kind of headache it is. And this is where it gets really, really useful for us day to day. Look at these clear differentiators. For tension type, you're looking for that classic, tight, gripping feeling. For migraine, it's that throbbing, one-sided pain plus the nausea or light sensitivity. These are the kinds of quick, practical pointers that help you nail the diagnosis while the patient is sitting right there in front of you. All right, now pay close attention because this next bit is probably the most critical part for us in primary care. We're talking about red flags, the stuff we absolutely cannot afford to miss. So for headaches, these are your big warning signs. That thunderclap onset, any new neurosigns, stiff neck, confusion. If you hear any of these, your alarm bells should be ringing. That's an immediate stop and investigate moment. And it's the same deal for neck and back pain, a history of cancer, unexplained weight loss or fever, and especially things like saddle anesthesia or new bowel problems. These are absolute, undeniable red flags. They tell us this isn't just a simple back strain. We've got to dig deeper and probably refer. So after you've screened for red flags, what's next? Well, this algorithm for low back pain spells it out perfectly. If you find a red flag, boom, it's one pathway: investigate and refer. If there are no red flags, you can proceed with confidence down the primary care management path. It just makes the decision tree so much simpler. Okay, so once we've done our due diligence and ruled out the scary stuff, where do we go from there? The guideline shifts gears into a much broader, integrated management strategy. And the philosophy here is really about hitting it from all angles. Yeah, meds are step one, of course, but look how quickly it moves on to physio for movement and OT for adapting daily life. It's a whole person approach. It's about treating the patient, not just prescribing for the pain. And check this out. This is one of my favorite parts. The guideline actually gives us these practical visual guides for exercises. These are things you can literally print out or show a patient on a screen. It's not just saying recommend physio. It's giving you a tool to empower your patients to start managing their own condition right from your office. All right, that was a quick tour. So let's boil it all down to the key things you need to remember for your next clinic day. So what are the big takeaways? Number 1, always be systematic. Don't skip steps in your history and exam. Number 2, red flags first. That's your safety net. Always screen for them. Number 3, use the criteria in the guideline to nail down your diagnosis. And finally, think beyond the prescription pad. Embrace that multidisciplinary approach. At the end of the day, this whole framework is built to help us make better, more confident decisions. So that really leaves us with one big question, doesn't it?
We have the framework, we have the playbook. The real challenge now is, how do we actually weave this into our crazy, busy clinic days to make that pain-free goal a reality for our patients?